Braces for the low back have been developed over the years to be more and more effective. Again, we commonly recommend that the brace be a guide for the patient to realize when their spine may be moving into positions that could cause harm. Traditionally, braces were of this kind that would Velcro in the front, and then the patient would have to then use their greatest strength to wrap the tabs around and Velcro, go ahead, one at a time. And in so doing, the Velcroing attempt would oftentimes not be tight enough to give the patient the feedback that we were looking for to avoid bending. In the case of the old braces, let me have it turn to the right, we would be asking the patient to feel that the brace would remind them that they should not bend over to pick up something off the floor, but as they bent, they would feel, go ahead and bend, they would feel the brace and be reminded that they must squat instead of bending in order to pick up something from the floor. The new technology of braces have a pulley system, and we know with the pulley system, a person can pull with very little effort, and you can see the loops of this very strong cable in the back going through a host of pulleys in the back of the brace on each side, so that it takes very little effort for the brace to be cinched vigorously. Okay, once that happens, then we have these two tabs. And the two tabs then can be pulled very vigorously so that one is Velcroed on one side at a time. And it took very little effort to produce this brace that for a person that had a disc problem, and we think of trying to unweight the body's weight off the disc, it is analogous to a long balloon and squeezing it in the middle, and the two ends go away from one another. In this case, if we had a person with disc-type pathology, cinching the brace up like this should give the patient immediate relief of their symptoms. And by so doing and squeezing here, the torso above the brace is elevated slightly away from the pelvis, and the brace is the material between the lower torso and ribs where it's contacting to the bottom edge of the brace on top of the pelvis. This is called the Aspen brace and is available online or at the Ultimate Back Store in Folsom and Sacramento. The low press lumbar support has a very broad contact for the abdomen that helps remind people not to bend forward. So with this broad, stiff material, then the patient would then be told to pull the two sides together so it's tight and Velcro one at a time. And with the broad front and it being very stiff, we're hoping that the patient is cognizant of whenever they feel any pressure from the brace here or here, that they're either slouching while they sit and need to be more vertical, or they're beginning to bend over and pick up something would be a grave error in driving up the disc pressure, when we would hope that the disc pressure would be as minimal as it could be while they're standing. We know that a person bends, the disc pressure goes sky high. If they bend too much, then ligaments in the back can get stretched. So if we can have the brace as a reminder of positions for which should be avoided, then that is a tool that we will oftentimes utilize to serve the patient while another level of healing has a chance to occur. So in sacroiliac joint dysfunction, the most frequent diagnosis we have seen in our clinical experience is that the joint is too loose. This could happen from a variety of traumas. It could be genetic. Some of the traumas could be that a person stepped down off a step, and when their leg hit the step and they unexpectedly were not producing a contraction throughout the muscles of the leg, the force of the body's weight would come down, and thus the ilium would be driven backwards while the weight of the torso continued forward, and so the joint would be positioned so that the ilium went posteriorly, or some people could say the sacrum flexed in relation to ilium. Nevertheless, we would find this joint to be too mobile and then have to do something to stabilize it with an SI brace, sacroiliac joint brace. The one that we recommend comes from a company in Ravenna, Ohio, called IEM. We have no kickback or business relationship with which we get funds from that company or they give us a break. We give the patient the information they need to contact the company after we take measurements that the company requires to fit for a semi-custom made SI brace. The two measurements that we need are the pelvic circumference, which is taken around the pelvis with a tape measure across this sharp prominence called the anterior superior iliac spine, and the tape continues around this prominence called the posterior iliac spine. And then that circumference would be measured, and the second measurement that we would record for the patient to submit to the company is the sacral breadth, which would be the measurement between these two prominences, left to right. Those two measurements would then be taken by the company, and the patient would then submit the information and get the brace themselves. And we usually fit the patient with the brace to show them how it can be most optimally positioned to give them the support they need, which is especially helpful for standing and walking. The brace sometimes can bind in the front with sitting, so we oftentimes recommend it for standing and walking, and then they may need to loosen the brace if they have a sitting position that they also need to be in. The IEM brace, once it arrives, is instructed to the patient that the sacral support must be positioned so it's between the two bony prominences called posterior superior iliac spine. So this is what one of the measurements was for, and so this piece is fitted so that the upper corners on the right and the left are fairly even to the superior iliac spine. Then she velcros the loop in the front, and then the important parts of this brace are that unlike other SI braces, these two iliac pads on the right and the left are going to be secured with the strap that loops around the sacral breadth pad so that the two ilii, left and right, are cinched toward the sacrum where the support is needed due to the hypermobile SI joint. So then we'll take one side at a time, and this is cinched up, and you can see the right pelvic pad securing the pelvis in the direction toward the sacroiliac joint that needs to be stabilized. And then we take the second one, and then it is pulled around, and the left iliac support comes in, pulling this ilium toward the sacrum to give support where the loosened ligaments are no longer sufficient enough alone to provide the support necessary that the patient can be pain-free in standing or walking. This is frequently necessary in not only trauma cases, but also with prepartum and postpartum after a birth, when the ligaments are quite loose from the birthing process. Other cases are when a person has hypermobility throughout many of the joints in the body, such as Marfan's disease or Ehlers-Danlos. In these cases, ligaments all over the body are looser than normal, including the SI ligaments, and this belt can help give the patient more function for standing and walking positions.